Well, I'm pleased to say that we were able to adapt in a number of ways. It was of paramount importance that we met the needs of our clients and patients even during this pandemic. So first and foremost, as an essential service, we were open for acute chronic emergency patients. It's important to realize at any point in time, I'll be seeing and taking care of anyone from fresh out of car accidents to major concussions to debilitating low back pain or massive headaches. By being here for them, not only could we provide the care they needed, but we kept them out of the hospitals. Last place in the world they wanted to go was a hospital, and it also reduced the load on the hospitals at that point in time as well. The science is clear how chiropractic care keeps people off opioids, so one more way of also keeping people out of the hospital. It's something where, very simply, I couldn't abandon my patients. I've been doing this for 30 years, and it's been my mission to actually help the community and the world at large. This was not the time to abandon our patients in this time of need. Also appreciate that a number of my patients are in fact other essential workers as well. So we have medical doctors and nurses and paramedics and police officers who are in fact patients. By keeping them healthy, it was one more way that we were also able to help with the pandemic. And also appreciate, was this not a clear message to stay healthy in the first place? And then last but not least, we were also able to offer telehealth for those patients who didn't want to come into the center. And we also were able to finish off some cutting edge online programs that we've been working on for a while in terms of functional health programs, everything from how to prevent Alzheimer's to optimizing gut and immune systems as well. Well, that's a great question. I often don't talk about my story and how this all began. But the truth is, I grew up sort of in an environment that was the opposite of health. You could literally go on my dad from head to toe and come up with health issues. Everything from heart disease to diabetes to diverticulitis, osteoporosis, osteoarthritis, and then, of course, unfortunately, cancer. And that's really what motivated me to know that my father had many, many good qualities, but his level of health was not one of them. And so, as my kids would tell you, I went to grade 22 to find those answers. And what I've discovered is people really have been misled. There are real solutions, but that you need to focus on true health. What you really need is you need two things. You need to find someone that you can trust, who has the level of knowledge that you need. And then, most importantly, you need to take action. This does not happen by sitting back. As a result, today I have one of the most successful health centers in the city, if not the country. We have literally helped thousands of people, and we get results. And especially for people who think they've tried everything. Essentially, we find out what's wrong, we help you fix it, and we've helped many before. Well, yes, I did found National Health Day some 15 years ago. Its sole purpose at the time was to get Canadians to understand the actual definition of what true health was all about, but more importantly, to understand that they need to take responsibility for their own health. And I know a lot of people will say, oh yes, of course, but the truth is they're not doing that. With respect to COVID, the focus was on social distancing and avoiding the germ and so forth. And obviously those steps had to be taken, especially to protect more of the immunocompromised. But there was really nothing about optimizing your own immune system, how being able to withstand these viruses in the first place. And also appreciate, this is not me being the armchair quarterback. I've been talking about this for decades. What are people going to do, when the next virus comes about? If you'd like to know what people need to do for COVID, they need to take responsibility for their own health. They need to take action. If ever there was a wake-up call for the need to be healthy, this is what it's all about. So what Canadians need to do, in fact the world, is they need to take all of the steps to actually achieve optimal health and then to maintain it at that level. No one else is going to do that for them. And if they did, they'd be amazed how resilient the body can be, and in fact how great a life one can